having the population immunized to a point where the risk is much lower. When do you expect that point to be? And leading up to that point, can you give us a sense of, if things are stable in terms of case counts and variants, what types of restrictions may be eased, in the coming next 2 months?
Yeah, it is a very tenuous time, and I expressed that a few times with my concerns. We've been grumbling along at a very high level for us of cases that we're seeing in our community, which tells us the virus is still spreading. It tells us we still have risk. At the same time, we're thankfully being able to accelerate our program of protecting those most at risk and trying to snuff out some of the outbreaks that we're having and the transmission change that happen in our workplaces. So, these are the things that are going to help us get through the next 2 months. There's going to be very little change in the next 2 months. But the more people that are immunized, the more, whether it's in the workplace stream or whether it's in our main age-based stream, that gets us that much closer. So these things work together to help get us all there. So what we are looking at, and I've had the privilege of working with faith leaders, for example, to look at how we can have small indoor services later in the month, outdoor events, which we know are safer than indoor events. Those are the types of things that will happen first. Looking at whether we can get back to some of the youth sports later in April, and we've approved some very good safety plans from the BC Hockey League, for example, but we're looking at other, particularly youth sports. We want to look at, as we're heading into June, making sure we can have a special ceremony for people who are leaving high school this year. It has been such a challenging year for youth, and I say that a lot, and I've been asked that quite a few times. Yes, I believe if we can continue through this program that we're doing, that we can have something special to mark that ceremony. And the fact that we've all been through this together, but it impacts young people in different ways. So those are the things that I'll be looking at. I've been asked a lot about, can I have a big wedding in April? And the answers are, not April. Keep it small. But by the time we get to the summer, if we get through this program, we continue to have the immunization, we continue to keep stopping our transmission, then we've been looking by the end of the summer into the fall at being able to have some local gatherings again with larger numbers. Some of the arts that we need will be coming online, but we're looking into, by June, if we are able to deliver what we are looking at delivering, and if we're able to keep a third wave from taking off, then we can look at some of those restrictions. And then there'll be some personal things. We've talked as well, and Minister Dix and I have been looking at details of how we can improve quality of life in long-term care and increase our visitation in long-term care now that we have so many people protected there. So that will happen sooner rather than later. And then we can look at our personal behaviors once we get into late in April, May, when we have most of our seniors over the age of 70 protected. Then we can look at whether it's safe to have those visits with our grandparents again, and to keep the elders and seniors in our lives safe in a better way.
Dr. Henry, if you're able to sort of elaborate on where we might be at in terms of easing restrictions. You said earlier that by the summer, which would be sort of June 21st, we could expect some restrictions to be eased. Yet you also mentioned that by the end of the summer or the fall is when we could get back to local-type gatherings. So, presumably by the end of June or June 21st, pretty much everyone will have had one shot. So between then and the end of summer, what type of activities could we expect to get back to?
Yeah, I know. I wish I could tell you. Unfortunately, I can just give you a sense of what could happen. What I would like to see, of course, is that our transmission drops off, that we have no more clusters and outbreaks, and 3 weeks after all of the younger people that we have in our lives are immunized, we're able to go back to lots of things. I just don't know that yet, and we're all in this same conundrum across the country. We were talking about it this morning with my colleagues across the country. What things can we do first? What things make the most difference? And I will tell you the principles that we're thinking through. One is that the more people that get together indoors, the greater the risk, regardless. And we've learned that. We learned that if you're indoors with lots of people, and it depends on what you're doing indoors. If you're sitting with a small group of people and there's barriers and there's other small group of people and you're not mixing, think of a restaurant, then the risk is less. If you're a larger group of people who are interacting with each other and moving between groups, the risk goes up. So, and numbers make a big difference. And it's not only the numbers, if you have 25 people, the probability that one person has this virus and might spread it to others is less than if you have 50 people. But the other side of it, from our perspective in public health, is we've learned that contact tracing, making sure we can find people quickly and stop that next generation of transmission, is also important in managing the pandemic. So that's why we had, for the longest period of time, a number of 50, because with safety plans in place, with the risk that we had in our community, the risk that somebody might actually have the virus in a group of 50 was pretty low for a long time, and the fact that we could find them and stop ongoing transmission because with our public health resources was pretty high. And then that balance got tipped over in late October into November when we saw this very rapid increase. And we were, all of my public health colleagues, watching things very carefully, and it really was almost over a period of a weekend that we saw such a dramatic increase. So we learned from that, and at that point, because our public health resources were getting stretched, we had to stop those indoor gatherings of any size because the COVID safety plans that we had in place weren't working anymore. The probability that somebody, even in a group of 10, was carrying the virus went up, and our ability to find them, because we were dealing with so many cases, had gone down. We're now at a point where we're getting back into a balance. We can follow up on every case. We can find people. We've been having small groups only, so that needs to continue so that we can keep that balance and keep our schools open and keep our hospitals from being overwhelmed and keep our surgical renewal going and keep as many workplaces as we can going. So that's the place we're in now. As we get more people protected and as we try, hopefully, to get transmission rates down, which means the probability that any one person will have the virus goes down, we'll be able to have larger groups again. But it'll be in a slow and phased approach so that we're safe in how we're doing it. So that's kind of a long answer, but it is to say those are the things we're thinking about as we move into summer. So how can we do safe graduation? How can we have small, safe gatherings over the summer period? I think I hope and expect we'll be able to get back to similar to what we had in the fall with the groups of 50, and then looking at expanding from there. The things that I think, on the other hand, we're not going to see this year are large international travel. So groups that bring people from many other countries to BC for an event, whether it's a conference or a meeting or a wedding or a family gathering, those things will be dangerous because we know that a vaccine is not available equally to countries around the world. And we've said this from the beginning, the risk anywhere is a risk everywhere. So we're not immune to that. So things like international travel, international gatherings, large festivals that have people coming from multiple places are not likely to happen this year. And things like cruise ships coming into BC are not going to happen this year either.